Hello everyone, my name is Dr. Terry Chen. I'm a chiropractor with Spine Care Chiropractic. Our treatment center is located in Penang, Malaysia. Now, I have been a chiropractor for 8 years, and today I'm going to talk about a condition that affects many people. The name of the condition is called slip disc. So, today I'm going to talk about what exactly is a disc and what exactly is a slip disc. Before we talk about this, to give you a better understanding, let's start with the human spine. If we look from the back, the spine is actually straight. If we look from the front, the spine is also straight. If you look from the side, you should see nice curves like this in the spine. Now let's zoom into the spine a little bit. And if we look at the picture in front here, the white structure is actually your bones. So sometimes on your X-ray report or your MRI report, it says things like L5, L4. So L5 is referring to this bone over here. This is L4, L3, L2, L1. And in between the two bones, you see this blue structure over here. This is called your disc. So when we talk about slip disc, actually we are talking about damage to this blue structure over here. And then the yellow things that you see that comes out to the side, to the left and to the right here, these are actually your spinal nerves. So if we look from the side, the nerve actually comes out in this hole here in between the two bones, and they travel to other parts of your body, for example your legs. So let's zoom into this blue structure over here and have a closer look at the disc. From the top view, actually the disc is made up of the outer ring. This red color outer ring here actually is made up of what we call fibrocartilage. And then in the middle here is a soft gel-like material. In medical terms, we call this the nucleus. So this gray thing in the middle is called the nucleus. At the back, this white thing here is your bone, and then in the middle is your spinal cord. And then on the left and on the right is your nerve roots, the nerve that goes to the rest of your body. So a normal disc, what you will see is that the gray material in the middle is actually enclosed and surrounded by this red color cartilage over here. What happens when you have slip disc is that there is damage to the cartilage and eventually it tears. So when there's a tear, what happens is the gel-like material, which is like a liquid material, it can actually leak out to the back, and then it bulges to the back and actually presses on the nerve and puts pressure on this nerve. And when there's inflammation, you start to get pain. So this is what a slip disc looks like. If we look from the side, again, this is the top bone, this is the bottom bone, this is the nerve that comes up from the hole. So you can see a normal hole is actually quite big. And then the nucleus is, in this case, instead of gray color, actually in this case is green color. And then the cartilage is blue color. So when there's a tear in the cartilage, the nucleus material will leak out to the back, and then it will actually pinch and irritate the nerve. And this is when you start to get symptoms. This is another view of the disc. This time we are looking at the side view and the top view together. So when we look at this view, actually the slip disc can happen in a few directions. For example, it can happen to the right, and in this case it's pinching on the nerve to the right. So in this case the left nerve is not affected. What's interesting is you can see as the slip disc becomes more severe, on the side view, right, the disc is actually quite thick, and as it gets more severe, you can see that the disc starts to collapse on the side view. And on the top view, it starts to bulge to the back, and then it presses on the nerve roots, in this case on the right side. Sometimes it can actually come straight centrally to the back. In this case, it's pushing on the spinal cord, and when that happens, you get the left and the right nerves both affected together. Then another thing is you can also get affected to the left. So when the disc goes to the left, only the left nerve is affected. your right nerve is actually not affected. Now, what you can see here is actually this nucleus thing technically is still contained by the light gray cartilage over here. When you have a more serious slip disc, actually this light gray cartilage, even the thin part over here, they can actually tear completely. And what happens is this nucleus, this gel-like material can actually just leak all the way out to the back. And you can end up in a situation like this, where you have what we call a free fragment. So you can see this fragment here just floating around inside the spinal canal. This is actually a more serious form of slip disc. So what will happen and what will you feel when you have slip disc? Well, for starters, you will actually get back pain. Most commonly, people will get back pain. And the other thing is, in the lower back, for example, the most commonly affected bone is the L4, between L4 and L5, so this over here, or between L5 and S1, this over here. And what you can see is that the nerves from L4 and L5, say for example L4, the nerve actually travels down your legs. L5 also travels down your legs. So in addition to the lower back pain, you might get things like pain in the legs, numbness in the legs, and even pins and needles in the legs. And furthermore, L4 and L5 nerves also actually controls your muscles. So you can see highlighted in green all the muscles in your body. All these muscles are controlled by the nerves coming from the L4 and the L5. So when you have a slip disc that is serious enough, it might actually start to affect your muscles. So you might get things like muscle soreness and muscle stiffness in your buttocks and also down your legs. And eventually it may also affect your leg movement, and it may also result in loss of movement in your legs. When the slip disc becomes more severe, and you can notice here, at L5 the nerve also affects your bladder, your rectum, and also your sex organs. L4 also the same. So when the disc becomes too severe, it can also affect your bladder and bowel function, and it can also affect your sex organs. In the neck, say for example you have a slip disc around, say the bone around C5, the level C5 or C6 or C7, it can also affect the muscles in your arms and your shoulder areas. And if you look at the nerves actually travels down to your hands. So like C6 goes to your hands, C7 goes to your hands, C5 goes to your hands. So you have slip disc in the neck. Symptoms that you might expect to get will be things like neck pain, stiffness, muscle soreness. It may affect the movement of your neck, and also it may affect the movement of your hands, and you might feel numbness, tingling, pins and needles in your hands, that sort of symptom. So I hope this has been beneficial for your learning. If you like this video, please share this video with your friends. So if you would like to be updated when we release our next video, please like our Facebook page and click on the subscribe button on YouTube. For the next video, I will be talking on what causes slip disc, and in the future video I will talk about how to treat slip disc. So until I talk to you next time, it's bye bye for now.